Today we have two session, one about the electrolyte and water metabolism, about extracellular and intracellular water, what is actually the problem. And the next session we will talk about the arterial blood gas measurement, especially related to pH and some actually disease which they known as acidos or alkalos. And the main actually organ in our body to regulate water, electrolyte, and actually pH is the kidney. For this reason, these two sessions are actually part of the kidney block. And from these two sessions, just I will give you 8 questions. The question, I have some example at the end of this session and the next session. They are similar to this example. And also, I have a book, a reference for you. 2 chapters of this is about these 2 sessions. If you need to study more, the book name is a Marshall Biochemistry. I will actually bring it. Unfortunately, it's my flash. So at the end of the class, I will give you the reference also. So the outline, first of all, we will talk about the water in the world, in our body, and what is the location, the intake and output of water. Then we have a definition of osmolality and extracellular fluid. Some of these definitions are actually part of our session. You know about them very well, just we have a brief review on them. Electrolyte composition of our body fluid, especially we will talk about the sodium and potassium more than other electrolytes because they are so important. We have some regulator like hormone, aldosterone, renin-angiotensin system, ADH. Just I have a brief review on the action of this hormone because in the next session you have a blood hormone and you will learn very well what is the function of all the hormone. We have some term related to ECF, expansion or contraction, isotonic, hypotonic or hypertonic contraction or expansion, and what is the output of this expansion or contraction in our body. And then we talk about the sodium and potassium metabolism. Then maybe we will talk about the chloride and calcium somehow, but maybe I omitted. It's dependent on the class and your capacity. But here we have actually decreasing or increasing in sodium and potassium, which is known as a hypo and hypernatremia and hypo and hyperkalemia, and they are emergency actually situation. All of these 2 sessions, they are related to urgent or emergency situation, and inshallah during your practice in the hospital, you will have some cases, some patients, which they have some problem related to these actually problem. So you should remember also, again in the physiopathology part, you have a kidney block again. And in the kidney, physiopathology of kidney, you will learn very well about all the cases. Just I bring some short cases which they are so actually, they are not so complex. But in the physiopathology, you will learn about the complex cases by the nephrologists, which they know more than us because daily they have some patient in the emergency part of the hospital and they bring some cases for you and we learn them very well. At the beginning of the classes, we have a case. In this case, a 55-year-old man was brought to the emergency with severe multiple injury in a road traffic accident and crush injury, fracture of the leg and skull laceration. He was conscious and breathing spontaneously. So is actually sample of the case. And the lab results are here. Pulse or beating was 130, blood pressure 60/40, serum sodium is 140, potassium 7.9, chloride 110, blood urea 40, serum creatinine 1.2. So you should learn all of them, but right now you don't need to memorize and actually interpret all of them. Just remember the potassium and sodium concentration, and at the end of the classes you can decide about this case and what is the interpretation of the laboratory data and what is the basis of the change. So just remember that. First of all, I wanted to actually give you some general information. It's not related to our course, but it's about the whole water in the world. Actually, as you know, our planet known as a blue planet or water planet. But near to 97% of the whole water in the world is the salt water and it's not usable. And just 3.5% of water is a fresh water, and you can see this fresh water is actually 70% just is a permanent ice and also is not available, and groundwater is a 30%, and lake and river is 0.3% of whole fresh water. That actually these two water are for human they can use. So the whole water in the world is so low, the fresh water. And actually these days you can hear there is a lot of problem related to water supply in the world, especially in those countries they're located in Africa and actually in Asia, more than Europe country, because Europe country they have a good groundwater and reserve. Here is just actually they are just extra information, general information for you. You don't need to memorize them. In the world, the water which used yearly, annually by the country, the India actually is the first country in the world because of its population and agriculture also. After India, China, United States, these three most populated countries, they also use more water. And after that, Indonesia and Pakistan, they use a lot of water, and Iran, unfortunately, after this country, is the next country. In this country, in our country, we use a lot of water in the world. And actually, Mexico, Philippines, and Vietnam are the other countries. There is actually animation related to water used by some countries. Just I wanted to show you some part of it. If you 2 minutes, just I think some of you saw that animation, but I wanted to. In comparison, it's actually started with Germany. Among the most populated countries, Germany used the lowest amount of water in comparison to other countries. If you look at them, it increased. And just I wanted to pass to Turkey, Egypt, with 77 billion liter, and Japan. Then after Mexico is Iran, and actually Pakistan, and then go to the Indonesia, USA, China, and India. And if you look at, it's just actually a good image of water used by country.
Are these figures?
Just 1 minute. Just 1 second to have a actually image, the whole image. Okay. Here is Germany, actually. Just use a liter water in comparison to your country, actually. If you look at that, they use the most part of water in the world.
They drink water a lot.
Not just drinking, agriculture. Because India is the most important country in the world for producing agriculture production. You know, without India, all the population in the world, they don't have enough food. We should remember that. And also Pakistan.
These numbers are per year, right?
Per year, yeah, per year. Just per year. It's a good animation, actually. If you want to, you can have it. So, it was about the water in the world and animally used. But in our body, here is important for us. Also, it's important, but for those actually political guy and the relation between countries. but here for us and for our lecture. Water in our body located in two actually main parts. In intracellular, actually, IC, and extracellular. How many percentage of our body is composed of water? 60% of our weight consists of water. And 40% of this 60 is located in intracellular water. Related to extracellular, we have the two main actually sources. One of them is the blood, and the next one is interstitial fluid. Intercell, actually, interstitial fluid, IS. This 40%, if you imagine one person with 70 kilograms we have, 42 kilograms of its weight consists of water. 28 kilograms of this 42 is located in intracellular water. And 14 kilograms is located in extracellular. About 3 kilograms is located in plasma, blood, and 11 kilograms is located in interstitial fluid. Also, we can divide it to 3 parts, and instead of that, we can use 10 and 1 kilogram. We call it transcellular water. What is the meaning of transcellular? Is transcellular fluid is about CSF, about ocular, pleural, perinatal, and synovial fluid. All of them are about 1 liter or 1 kilogram. So we have a 3 or 3 kilogram or liter, doesn't matter. You can change them to the liter. Is a transcellular what? Ovarium. What come? This 60% is for adult and for men. For women is about 55%. Amount of water in women is less than men. Why?
But I think I'm wrong. I think I'm wrong. It's because they get angry quicker, so they evaporate more water, right?
I didn't get.
They get angry quickly.
Angry quickly.
Yes, so they evaporate the water.
Be polite about the woman.
Because of the weight.
Because of the weight, no. If you imagine 2 persons, women and men, same equal weight, the amount of the percentage of water in the men, no. Your answer is
No,
fake.
it's the correct. I think it's because women they have a larger percent body fat than men.
Exactly,
So
adipose tissue. Because of adipose tissue. Among our tissue, adipose tissue has the lowest amount of water. For this reason, and in actually women body, they have a high percentage of adipose tissue. The amount of water in the women is less than men. But during our life, this percentage of water is different coming. Salam alaikum. In infant is about 75%, and when we become old, is decreased to less than 50%. So during our life, this percentage will change. But totally we say is a 60% and is located inside cell, in the space between our cell and our blood, 3 liter, 1 liter, and 10 liter form extracellular, and 28 in the actually intracellular. Here again and also again, I have a sum. Our body is consists 100% weight. 40% is an element, protein, and other. 60% is fluid. 40% in intracellular, ICF, extracellular, ACF, 20%. This ACF consists of plasma, interstitial fluid, and actually transcellular, and is about the kilogram of actually water in our body is about 42 kilograms is equal to the liter, doesn't matter. In interstitial fluid is about 11 to 15, transcellular and lymph, blood plasma, which is equal to the 3 kilograms. So you learn them. And about the tissue, here in muscle, 75 to 80% consists of water, connective tissue 60%, adipose 20, bone 25. You can see. Adipose tissue have less water in comparison to bone. But just teeth, toes, or actually teeth, they have less water in our body, 5%. After the toes, just adipose tissue with 20% has the lowest amount of water. But gray matter has 80, white matter has 70%. So, for this reason, because of adipose tissue, actually the amount of water in women is less than men. Here also is for extra information, the amount of water actually your body needs. It's ounce or ounce. Each ounce is equal to 30 milliliter. Okay? And each 8 ounces is equal to 1 cup. 1 cup is equal to near to 240 milliliter. Okay? And 1 gallon is equal to 1 gallon is equal to how much?
16 cups.
3.7 liter. Okay? So daily in our body we need near to 1.5 liter. Daily we need 1.5 liter to intake. Is equal to 8 cup. So 8 cup we should drink daily to provide enough water for our body. Actually, and as I mentioned, this can be different about the age. In infant is 75 to 80%, in elderly is less than 40. And gendered women, they have less body water in comparison to men because of the actually adipose tissue, and its total body water doesn't matter. Related to importance of water in our body, we can lose nearly to all fat and actually half of our protein without any problem, and we are still alive. But if we just lose 10 to 15% of water, we will die. So water is so important. For this reason, is an emergency situation. And in the actually the high temperature, increasing in each degree raise 13% of the amount of water which lose in our body. So, in adult, actually, the percentage body water is high compared to the skin surface. And actually, the adults are not prone to the dehydration. In adult, we don't have a big problem, especially about the infant. They are at high risk for dehydration. For those infants which they have a vomiting or diarrhea, diarrhea and vomiting in infant is a so emergency and important situation. And as soon as possible, we should take them to the hospital, and they have to handle and manage their situation by giving fluid and actually serum or other actually fluid that they need. So it's so important, and just 10 or 15% losing of water leads to the death, especially in the infant. Daily, the amount of water which we receive or intake is equal to the amount of water which we lose. It's similar. But sometimes this balance will change. The main reason of the balance is the model when the water output is more than water intake. What is the reason of this situation? Water intake is actually related to inadequate water intake. It's due to two reasons. One, lack of clean water. We don't have access to clean water. And the second reason is a psychogenic refusal to the drink. We have a rabies disease. You hear about that? Those actually patients, they fear from water. They don't actually like to receive water. For this reason, they refuse. It's a psychogenic refusal to drink, and the water intake is decreased. I think you studied this rabies recently in the microbiology part. Yes.
Yes.
Rabies virus. Why you don't remember that? You didn't participate in the classes of Dr. Faisal?
He was absent during the
For
class.
this reason, yeah, I know.
I already watched it on YouTube, so.
You have to study Java. And the main reason for increasing water output, loss of blood, vomiting, diarrhea, diabetes mellitus, actually burns, diuretic use, and lack of ADH. They are the main reason for excessive losing water. So the symptoms: loss of weight, raising body temperature, increase in heart rate and cardiac output, decrease in blood pressure, and sunken eyeballs. This means that actually this part of actually eye is swelling. So they are the symptom of the dehydration. And in other way, some reason lead to the hydration or overhydration. When the water intake is more than water output. Sometimes is an excessive IV or intravenous administration of fluid. Every person referred to the emergency part, they use a serum. So they should be careful about the IV administration because sometimes lead to the overhydration. And also some psychogenic drinking episodes. It's actually happen for all of us. Sometimes we feel we thirst so much and we drink a lot of water. It's just actually a part of our feeling. And if we drink a lot of water without electrolyte, it's also lead to the overhydration. And maybe we have a decreasing in water losing. It's maybe due to this reason: renal failure or congestive heart failure.
What does heart failure have to do with decreased urinary output?
Heart failure with the decreasing, yeah. You know, when we have a heart failure, the amount of water which received to the kidney is low. And then the amount of water which lost by kidney is low. What is the symptoms? We have decrease in body temperature, increased blood pressure, edema, and weight gain. Especially edema is so important among these situations. So, daily water balance in adult actually, in different references we have a different number. But overall, daily we receive 2.5 liter water and we lose 2.5 liter water. Among them, 1.5, some references they believe 1.1 or 1.2 liter by urine we lose, and this amount we receive by diet. So diet is the main, or drinking instead of diet, is the main source of water intake, and urine is the main source of water excretion. In the next slide, here we have actually some number. About water intake, drinking 1.5 liter, metabolism 250, and food 750. So the overall is about 2.5 liter. Do you remember from the metabolism?
Yes, from digestion, water is formed in some. I think it's from electron transfer chain, and also from the digestion of, I think it's lipids.
Yeah, exactly. During the lipid synthesis, we produce water, and some other, actually during the oxidative phosphorylation, also we produce water at the end of the ETC, electron
Yes.
transfer chain. So you have some pointer? No. And related to the losing water, 1.5 daily by urine. Especially, we need at least 0.5 liter water in the urine to excrete the waste product. At least we should have a 0.5 liter urine. But we have more water. In men is about 1.2 liter daily normal, and in women is about 1 or 0.9 liter. But in actually diabetes is increased, maybe more than 2 liter. Okay. So we have a urine analysis in the previous
Yeah.
semester.
Yeah.
Dr. Gashly actually, I think, with you. And actually one of the criteria for 24-hour urine is volume, and you should evaluate the volume. So related to water losing, 1.5 by the urine, but we have a water losing by feces, 4%, actually 100 milliliter, by sweat, 200 milliliter, 8%, and we have an insensible losing via skin and lung by breathing and by skin. We can't feel it. It's about 700 actually milliliters. And now also here you can see water in food 1.2, oxidation 300, drinking 1.2, is a 2.7, urine, skin, lung, and feces 2.7. The water, actually there is a balance between intake and output. And some references actually use different number, doesn't matter. But totally we know urine is the main sources for output, and actually drinking and food are the main sources of the input or drink. So total is 1.5, 1.5, losing and proportion. So for the controlling of this balance between output and input, for intake we have two mechanisms. One is thirst, and the second is the rate of metabolism. When the water is decreased, the center of the thirst, where is the center of the thirst? In our
Brain
body?
stem.
Hypothalamus. In the hypothalamus, we have a center of thirsting, and actually it's increased some hormone. Which hormone? Antidiuretic hormone, ADH. And ADH actually goes on the kidney, our function, and lead to the reabsorbing water, and increase the water. And the rate of metabolism. When the water is decreased, we increase the rate of metabolism to produce more water. And otherwise opposite.
So someone who's thirsty will feel hungrier.
Feel hungry also.
To increase the rate of metabolism. So someone who's thirsty will feel hungry.
Not exactly. The hungry also, we have some center in hypothalamus dependent on a lot of functions, not just about the water intake. And about the output, renal function is the main actually regulator and controlling the amount of water output. The rate of loss through the skin is influenced by the weather, and as you learned, is increased near to 13% when we have each 1 degree increasing in the temperature. So when you are outside, please, when the actual temperature is so high, you have to have water with yourself, and in addition to pure water, you need to use some electrolyte also, not just pure water. If some water they contain some juices or other electrolyte, is so much better than pure water. Because by sweating, you lose water and electrolyte. And by receiving a pure water, the amount of electrolyte, especially potassium and sodium, will change. And your body cannot handle it. So you need to use actually juicy water, not pure water. So we have some terms about the water. One of them is osmolarity. You know about its definition. What is osmolarity?
Osmolarity is the what's it called? You know, like how much water will permeate through a cell membrane, or into or outside of the
It's
cell.
about the actually
Veins, and the capillaries. I remember from
exactly.
the blood
It's about
pressure.
osmolarity. But we have a two terms, osmolarity and osmolality. When we say osmolarity, it means the osmotic pressure excreted by a number of moles per liter of solution. And osmolality
Per kilogram.
per kilogram of solvent. Per kilogram of solvent or per liter of the solution. Usually we use osmolality in plasma, not osmolarity. So osmolarity definition. The crystalloid and water can easily diffuse across membrane, okay? But osmotic gradient is provided by undiffusible colloidal or protein particles. So protein are the responsible for the osmotic pressure.
What's crystalloid? Is it the different minerals and?
Yeah, no, they are the mineral, like actually sodium, potassium, some of them. Actually, colloid osmotic pressure is excreted by protein, as I mentioned. And if this gradient is reduced, the fluid will change about this inside the cell and outside the cell, and we lose a lot of water to extracellular fluid and leading to the edema. So the albumin is the responsible for maintaining osmotic balance in our blood. Albumin is the main protein. In addition to albumin, some electrolyte, especially sodium, is the main electrolyte for osmotic pressure regulation. And we can measure the osmolality of plasma by two methods. One of them is an osmometer. The osmometer directly evaluate and measure the osmolality of plasma. The amount of the normal range of osmolality is about 290, about 250 to 295, 85 to 95, and actually the normal range is 290. 290. Remember that number, it's so important for us. And how we can calculate it? The main important electrolyte is the sodium. Okay. The sodium concentration in the plasma is about 140 milli equivalent or millimole per liter. Okay, both are equal. And because for each cation in our blood, we have an anion also. So this much also we have anion. So sodium and its anion together, they equal to 280. So in the plasma, from 290, 280 is just provided by sodium and its anion. And glucose and urea are important for 5 and 5. So if you remember from the first case, in addition to the osmolality of plasma, we also have a urea, sometimes creatinine, and I don't know when glucose was included or not, but we need also to know about the glucose concentration. So how we can calculate? Sodium multiplied 2 is equal to 200, glucose 5, urea 5, together are known as a 290. Sometimes when we measure osmolality directly by osmometer, we have one number, for example, X. And when we calculate it, is Y. And actually, there is a difference between X and Y when we directly measure and when we calculate it. These differences in measuring osmolality and calculated, known as the osmolar gap, like onion gap, which I will talk about it. When abnormal, actually, situation occur, like actually a lot of ethanol, mannitol, neutral, and cationic amino acid, they lead to the osmolar gap, increasing or decreasing the measure and calculate. So osmolar gap is a problem. The main factors for osmolality, they are electrolyte and non-electrolyte. Non-electrolyte including glucose, urea, uric acid, and protein, especially albumin in plasma. Again, here is from another references, sodium with onion, here accounted for 270. And potassium, calcium, magnesium, all of them for 10. Urea and glucose 5 and 5, and finally is equal to 209. It doesn't matter. You can calculate 80. What's happening?
Should we memorize these figures exactly, or?
No. I told you. You should memorize that is a 290, and actually sodium is important with 140. Just that glucose, urea 5. Sometimes, are you good? Go outside there, drink water and tea. Sodium, potassium, magnesium, calcium, chloride, and phosphate, not phosphate, just they are 1 unit, plus or actually negative. The millimole and milliequivalent is similar. We can use both. But for those, they have actually different capacity, 0.2, 2, 3, and more. The milliequivalent is different from millimole. But because the main electrolyte are sodium and potassium, and both of them they have 1 capacity, we use millimole instead of milliequivalent. They are similar because they have 1 unit. Related to these actually electrolyte, we have actually an area which they are optimal, the concentration. But in both situations, when they are deficient, they lead to the disease and pathology condition. And when they are so high, they lead to the toxicity. So this area is for optimum level. For macronutrient is so wide, for micronutrient is so narrow. So for macronutrient, it's actually small changes in decreasing or increasing lead to the deficiency or toxic. But in macro, we have a broad range. Here, also these numbers are important for us. In this slide and the next slide, I bring them again and again. Related to main cation, there are sodium, potassium, calcium, and magnesium. And onion, chloride, bicarbonate, sulfate, phosphate, and protein. Okay? We should know about the concentration in plasma and in intracellular fluid. Interstitial fluid is somehow similar to the what? Extracellular or plasma. So they are so similar. So you don't need to know about the interstitial. If you look at the number, just there is a little difference between the interstitial and plasma. But intracellular is important for us. Sodium in plasma, as you learned, is 140. But in intracellular is so low, just 12. In opposite, potassium in plasma is 4, intracellular is 160. So right now you can understand. The main cation in plasma is
Sodium.
in intracellular is potassium. So the cell divided potassium and sodium. Potassium inside cell and sodium outside the cell. Calcium and magnesium doesn't matter because if you look at the number, they are so low in comparison to sodium and potassium. Related to anion, chloride and bicarbonate. Both of them are the main anion in plasma, 105 and 24. Together, they are equal to 129. 129 and 128. But inside the cell, phosphate is the main anion, 140. Here again you can see in plasma, sodium 140, potassium 4. Okay? Related to anion, chloride and bicarbonate, 105, 24. Interstitial doesn't matter for intracellular. Potassium is the main one, and sodium and magnesium, and phosphate is the main anion, in addition to protein, bicarbonate, and chloride. So all the time, if you imagine is 140, and here is 129. We have a differences in amount of anion with the amount of cation, which we measure. We call them unmeasured anion. Unmeasured anion. Okay? This unmeasured anion usually is about 12. 10 to 12. All the time. You got it? What is that? Yeah. We measure anion, chloride and bicarbonate. And we measure cation, sodium. There is a difference between these two numbers. We know all the cations should be equal to the anion. We have some anion which we don't measure. Sometimes this unmeasured anion is increased. We call it anion gap. This is known as anion gap. And when it's increased, we call it high anion gap. What do you think about the high anion gap? What is the reason of high anion gap?
Perhaps due to diet, for example, someone doesn't consume enough of a certain mineral or something, so because always it's excreted a bit from the urine and in the sweat, so they have a deficit, which causes this gap.
Dehydration. Actually, this anion here, which shown in black, there are some anion we don't measure, like pyruvic acid, lactic acid, ethanol, other actually anion. Okay? Especially lactic acid. During some actually condition like diabetic ketoacidosis, the amount of lactic acid production is increased and lead to the high anion gap. I will talk about it more in the next slides. So here again, main cation is a sodium, main anion is a chloride bicarbonate in the plasma, and inside the cell, main cation is a potassium, and main anion is a phosphate and protein. Okay? Potassium, magnesium, phosphor, intracellular, extracellular sodium, chloride, and bicarbonate. You should remember this now. How we can regulate this cation and anion and actually the amount of water? By some hormone, like aldosterone, ADH, and renin-angiotensin systems. I know you actually study about the renin-angiotensin system and also the action of ADH, just I bring into a slide very briefly about their function. ADH made in hypothalamus, and actually it's the water conservation hormone. It's an antidiuretic hormone. It's stored in the pituitary. Yeah, the posterior part of the pituitary. When osmolarity of the plasma rises, the osmoreceptor in the hypothalamus are stimulated, and resulting in the ADH secretion. So ADH function is that increase water reabsorption by the renal tube. And actually we have some channel, they are known as aquaporin. It's increased the amount of this aquaporin channel and reabsorption of water will increase. Therefore, water and sodium actually they reabsorb and it's maintain the osmolality in the plasma. When osmolality decreased, ADH secretion also is inhibited. So it needs to lose some water to osmolality, went back to the is normal situation. Related to aldosterone, you know, is a hormone which produced by adrenal cortex and released as a part of renin-angiotensin mechanism and act as a renal distal convoluted tubule. What is the function? The function of aldosterone is two. One, increasing sodium uptake from distal tube, and also the second, increasing the potassium excretion. So sodium uptaking is increased, potassium excretion also is increased by aldosterone. How aldosterone starts to its work? By the renin-angiotensin systems. You know, we have some cell in kidney which they are known as a juxtaglomerular cell. And they feel the blood pressure. In response to the decrease in the blood volume, they will start to secrete the renin. Renin actually, when it's produced, lead to the converting angiotensinogen to the angiotensin 1. Then we have an enzyme which is known as angiotensin converting enzyme or ACE. Angiotensin converting enzyme ACE. Convert angiotensin number 1. What is that?
Should I give you a tissue?
ACE
Hier noch ist der
converted
Juice am Platz.
angiotensin number 1 to the thank you. Angiotensin number 2. Is it? So this ACE is so important enzyme which is produced by lung. And then this angiotensin 2 lead to the production of aldosterone. Actually, it has many functions. One of them is production of aldosterone is increased, then has an effect on the cardiac output and also in the kidney function. Angiotensin to stimulate adrenal gland to release aldosterone and cause an increase in peripheral vasoconstriction. The factor which stimulate renin from the kidney are decreased blood pressure, salt depression, and prostaglandin. And the main reason for renin inhibitor are increased blood pressure, salt intake, prostaglandin inhibitor, and angiotensin 2. Related to angiotensin converting enzyme ACE, hypertension is a problem. Sometimes we don't know about the reason. It's known as idiopathic. But the medical doctor, they say the main reason for hypertension, more than 70% of hypertension is due to the kidney dysfunction. And the kidney is the main regulator of hypertension in our body. If our kidney works healthy, we don't have problem in the hypertension. One of the main important of the drug for hypertension, they are known as a captopril, enalapril, and other drug for this family, which all of them they are ACE inhibitors. all of them, they are ACE inhibitor. When ACE is inhibited by captopril and enalapril, angiotensin II is not produced, aldosterone is not produced, and also sodium is not reabsorbed, and the blood pressure will decrease. So, renin, angiotensin, aldosterone, actually the system. I think you studied this system.
Yes.
Yeah, very well. Just I have a actually brief review on it. Related to the disturbance in fluid and electrolyte balance, we have three situations: isotonic solution, hypertonic, and hypotonic. What is the definition of this? When we say isotonic solution, the osmolality of this solution is equal to the osmolality of plasma. So the size of the cell doesn't change after using isotonic solution. But sometimes we use a hypotonic solution, which means the osmolality is less than plasma. It's about 280, 270 or some other. Because it's a hypotonic, it's lead to the swelling of the cell. Okay? And in opposite hypertonic solution, for example, 630 osmolality, is lead to the shrinking of the cell. So we have some serum like 0.9% of sodium chloride solution. It's known as a normal solid. It's the main actually serum which used daily in the emergency part of hospital. Is equal to 280 and it provides the sodium and water for body. The osmolality is equal to the plasma. In addition to this normal solid, we have a Ringer solution and lactated Ringer solution. Again, the osmolality is equal to the plasma. Related to hypertonic solution is about 3% sodium chloride, 5% sodium chloride, whole blood, albumin, and concentrated dextrose. All of them, they are hypertonic, and hypertonic 5% dextrose, 0.45% sodium chloride, 0.33 sodium chloride, which the osmolality is 1/3 of this. So different situation, we use different solution also. But mainly we use isotonic solution, and among them normal solid or 0.9 sodium chloride is the